Hi, let's talk about acute kidney injury. Acute kidney injury, or AKI, is a sudden drop in kidney function that's potentially reversible. That is what sets it apart from chronic kidney disease, CKD, which typically develops slowly over time and keeps getting worse. The main signs of AKI is reduced urine output, ranging from oliguria, which means less urine than normal, to anuria, which is almost no urine production at all. When the kidney's filtration drops, the glomerular filtration, waste products build up in the blood. This is why you'll see a rise in creatinine and urea in serum. AKI is usually divided into three categories based on where the problem starts. There's prerenal, intrarenal, and postrenal. Prerenal AKI happens when blood flow to the kidney is reduced. Since the kidney's filtration depends directly on blood pressure and perfusion of the kidney, anything that decreases blood reaching the kidney, like dehydration or blood loss, will drop the GFR and reduce urine production. This is actually the most common type of AKI, and you'll see it a lot in surgical patients. Postrenal AKI is when something physically blocks urine from leaving the kidney. A classic example is a kidney stone stuck in the ureter. Even if just one kidney is blocked, that can be enough to cause AKI, especially if the other kidney isn't working perfectly. The GFR drops in postrenal AKI because the urine flow backs up into the nephrons and pressure builds up, working against the pressure inside the glomerulus. And then there's intrarenal AKI, which means there's a problem inside the kidney itself. We can break this down further by looking at which part of the nephron is damaged. The glomerulus, the blood vessels, or the tubules. Glomerular damage usually comes from glomerulonephritis, where the kidney's filter gets inflamed, typically because immune complexes, basically antibodies stuck to antigens, get deposited there. Vascular problems include rare conditions like thrombotic thrombocytopenic purpura or hemolytic uremic syndrome, where tiny blood clots form in the smallest vessels. And then there's vasculitis, where small blood vessels throughout the body, including the kidneys, become inflamed. Tubular damage can happen in several ways. Toxic substances like certain antibiotics can directly kill tubular cells, or prolonged lack of blood flow can cause ischemic injury and lead to necrosis. Check out this video on tubular damage to learn more. There's also tubulointerstitial inflammation, which can be infectious, like when an urinary tract infection spread up to cause pyelonephritis, or allergic, like acute interstitial nephritis triggered by medications. And finally, crystals like oxalate or uric acid can physically block the tubules, so the lumen inside the nephron, and stop urine flow and production. We already have or will have separate videos covering each of these topics individually in more detail. No matter the cause, AKI gets staged into three grades based on how high the creatinine rises, or what the absolute creatinine level is, or how much urine output drops. This staging system is useful because AKI can happen suddenly in someone with previously healthy kidneys with a normal creatinine, like from a kidney stone, but it can also happen in someone who already has chronic kidney disease from diabetes, who has already high levels of serum creatinine. What symptoms can else be seen in AKI? When GFR drops, the kidney can't get rid of potassium and protons like it normally does because it's an active process. And this can lead to hyperkalemia, so too much potassium concentration in the blood, and acidosis. These are processes responding to aldosterone, and you can check out this video on how aldosterone works. When the GFR falls, less fluid reaches the segments in the nephron, so even though the pumps might be working, there's just less opportunity to dump potassium into the urine, and it builds up in the blood. Potassium imbalances can lead to serious arrhythmias of the heart, since they change the membrane potential of cells. That's why an ECG is typically taken in AKI. Let's wrap this up. First, acute kidney injury is a sudden, potentially reversible loss of kidney function, marked by decreased urine output and rising creatinine in serum, which is different from chronic kidney disease, CKD, that progresses slowly over time. Second, AKI is divided into prerenal, intrarenal, and postrenal causes, with prerenal being most common and usually related to poor blood flow to the kidneys. Third, intrarenal causes break down by where the damage is: glomerular from inflammation, vascular from clots or vessel inflammation, and tubular from toxins or lack of blood flow, but also infections and drug reactions or crystal blockages. And fourth, AKI is staged into 3 grades based on creatinine in serum or urine output, which helps doctors assess severity no matter what the patient's baseline kidney function was. And lastly, AKI can cause dangerous complications like hyperkalemia and metabolic acidosis because the kidney can't excrete potassium and acid properly anymore, and these can be life-threatening if not treated quickly. I hope this video was helpful. Consider subscribing, and I'll see you in the next video.